Stephen, you alluded to something. You just slipped a phrase in there, which is unmet needs.
Right.
Right. And we've been talking about, if you'll permit me to use this phrase, the 10,000-foot view. We're trying to affect progression of this disease. But there's a nitty-gritty to treating MS as well. And there are people with bladder dysfunction, and there are new treatments, and bowel dysfunction and depression treatments. Are we discussing apples and oranges here? I mean, are these therapies that we've been discussing really impacting the other unmet needs of MS, or is that an entirely different topic?
Well, I think it's important to remember that these are the preventative strategies, right? These are the strategies designed to keep our patients from worsening. And none of these medicines themselves take away symptoms that patients already have or disability that they've already accumulated. I mean, that's a great vanguard for our field that we're not there yet. But I do think, the way this ties together is the sorts of things we've been talking about are the things that we often care about. But when a patient comes to see us, they don't necessarily care about the clinical trial results and the numbers of gadolinium-enhancing lesions. They want to feel better. They want their walking to be better, their bladder to be better. They don't want to be depressed. These are the things that are on their list of priorities. And I do think that we need to budget the scarce resource of face time that we have with our patients to some of the things that we think are important and then some of the things that they think are important, and really address those things. They're important drivers of quality of life, and they're what are going to keep our patients coming back to us.
Mm-hmm. Yeah, so I entirely agree. I think it was stated beautifully. This is really an important aspect of people's lives, living on a daily basis with MS and their family members, that to really try and improve quality of life. And so symptoms need to be actively managed and actively sought out what the problems are, because if we spend our whole time just talking about the disease-modifying therapy in our face-to-face time,
right,
then we've missed the boat.
And I would just add that that's a place where primary care doctors who are MS familiar can really play an important partnering role with us in helping to manage these symptoms, which are so important. But maybe the neurologist or the MS specialist might not be the best equipped always to do it.
Or it may be the place where the primary care physician can pick up something that you on your every 6 month or every year.
I also want to make a real pitch for how important a health maintenance wellness program is. We now know that helps CNS reserve, brain reserve, and this is, being the optimum body weight, regular aerobic exercise, not smoking, moderate alcohol, raise your vitamin D level to high normal, make sure you're not B12 deficient, you're eating a good diet, you have good sleep, you have mental and social stimulation. These are critical things that actually treat everybody and help the central nervous system maintain itself and repair.
Anybody else struck over the years by the similarity of all the recommendations of all the disease specialists? They all come together, the same stuff that people are recommending for heart prevention, heart disease prevention, MS control. There's something core in this that we will probably understand as we go forward. Do you agree with that?
Yeah, it's
Absolutely.
the nervous system. That's the core.
All right, you just think it's the nervous system.
Well,
Well, because you're a neurologist.
I'm biased in that direction.
Look, this has been a great